All right, so what we're going to be doing in this video is we're going to be looking at the anatomy of the rotator cuff. So in this muscle, we have four separate muscles, and we're going to be going through each one of those, their attachments, and kind of what they do. When you hear the word rotator cuff, this is going to be the one that's really rotating that that shoulder joint, that glenohumeral joint, between medial rotation and lateral rotation. So where we have it here is how we mentioned, we have the greater tubercle and we have the lesser tubercle. We did that kind of thing here where we zoomed in. So if you look at the greater tubercle here, we have all of these muscles that attach to that greater tubercle. And then we have the lesser tubercle where we have one here. Now I don't have the connective tissue on here for like ligaments and stuff, but I can add some of that in so you can kind of see how they all relate to one another. How many layers do I want to put in? All right, so you can kind of see where everything sits. So you have this bursa here, which is going to be the subacromial bursa. That's going to be sitting in between the supraspinatus muscle and the acromion. That means when this muscle is working, we're not rubbing up against that bone right there, the acromial bony landmark. And then we have this bursa here, so we're not, when we put the deltoid on top of that, when we add more muscles onto it, you don't have the deltoid rubbing up against the humerus bone. I'm going to take some of these off just because they're not necessary for us to have them. But you can kind of see how the ligaments are associated with it, and how everything kind of works and is how it's situated in this area. All right, so we're going to start with the supraspinatus. Now, the supraspinatus, this is a really, really important muscle. This muscle helps us to do that first 10% of abduction, but it also holds that shoulder into place. So like if we're carrying a heavy object, carrying something that's weighing our arm down, this muscle is activating. So if like, I love my my client. I have this one client, she has a frozen shoulder. I've been working with her for a while, and I told her, I was like, you have to start carrying your purse on another side. She's one of the older ladies who believes that the bigger the purse, the better. And her purse weighs a ton. I actually picked it up for her once. And I was like, oh, yeah, this could be a problem. But she likes to carry it on the one side that's hurt. And I was like, this is actually contributing, so stop it. And it's just one of those, sometimes it's a habit that they have a really hard time getting out of. So supraspinatus, so let's kind of look at this muscle. It goes here from the supraspinous fossa as the origin, so that right above the spine of the scapula, all the way over to that greater tubercle of the humerus. The cool thing about, I love this program because it does motion. So this does shoulder abduction. So let's look at shoulder abduction and kind of what this looks like. Takes a second. Here we go. And we are going to fade all but the one muscle we're looking at. So you can kind of see how it activates when it's yellow. So it shortens. It will continue to shorten as you go up, but that first 10% is which all of this, and then the other muscles will start to contribute. So like the middle head of the deltoid, that lateral acromial head of the deltoid, will actually help after that first 10%. That's when that kicks in. But this is the primary thing for the first 10%, but it does that abduction movement and then also holds it in. So we're going to stop that. We're going to go back, and perfect. All right, so supraspinatus muscle. The next one we have is infraspinatus muscle. This one is a muscle I find is very forgettable. As a massage therapist, a lot of massage therapists will actually forget this muscle. So the infraspinatus muscle, this is going to go from the infraspinous process out to that greater tubercle, and this is going to do a lot of lateral rotation. So We have lateral rotation. Let's get that one pulled up, and then we'll fade all the others. So we have that. So this is where if your elbow's bent, you go from touching your tummy out to where your hand's out to the side. So that's that lateral rotation. It also does transverse abduction. This is where the arm, where you kind of bring your arm out completely at the shoulder and then away from you. Kind of like you're saying, like, here, give me a hug. So we'll fade the other muscles. So you see how that, I'm going to talk about how you pull the arm up. So once it goes yellow, that's when it's activating, and then boom. And that's kind of like a form of lateral rotation. There, we'll go back. Oh, I just hit the home button. I don't know if it'll actually do it. Okay. See, back. I want one more. That's what I want. Okay. So we have the infraspinatus muscle. Then we have this tiny, tiny, tiny little muscle here. This is the Teres Minor. This is going to be a very isolated lateral rotator. That lateral rotation is going to look the same as the infraspinatus. This goes from the very lateral border of the scapula all the way up to that greater tubercle. Now, this muscle, it's very, very small. You're looking at maybe like 3 inches on a large person. It's a very, very small muscle, and it can get lost in between the infraspinatus and the teres major, which is just below this teres minor. There's very specific ways to address this muscle. And so if you're going to take my injury course, we actually do go into working on that teres minor muscle just a little bit more. And then the last muscle we have here in the rotator cuff is we have the subscapularis. Now, subscapularis muscle, if you take any neuromuscular therapy techniques such as like Eric Dalton's, James Wolzowski, sometimes even into Rolfing, you'll hear something called upper cross syndrome. With upper cross syndrome, this muscle is one of the ones that is most effective and least worked on because of how difficult it is. It is sandwiched in between the serratus anterior, which we're going to get into in a later video, and the scapula. So this is the one where you have to really go into the armpit to really get at this muscle. This does a lot of medial rotation. Most people sit in medial rotation. So when you're watching people, when you see people laying down, they're not laying with their palms up. A lot of them will lay with their palms down flat to the table. If you look at them walking, the more posterior their palms are, the more medial rotation is happening in their shoulders, which is really affecting this muscle here. So subscapularis muscle. Let's see if we can get the motion going. There. We're going to fade all. So medial rotation, so bringing that arm around. And we can see it all the way from here. So we're bringing that arm in and through and rotating it in. And with upper cross syndrome, if you see, let's see, can I unfade a muscle? Yeah. So if we see that pec major, if that pec major is tight, and we always talk about, oh, my back hurts, this could be one of the reasons. And with things like carpal tunnel syndrome, thoracic outlet syndrome, pain referral zones for that subscapularis go all the way down the arm. So it's really important to get that work done if we can. We're going to go back. All right, so that is the rotator cuff muscles. So we have the 4 rotator cuffs: supraspinatus, infraspinatus, teres minor, and then subscapularis. We're going to get into some of the more shoulder muscles here in the next video. So we will see you then.